going to talk with Dr. Gerald Rieber, Prairie Lakes Healthcare, Prairie Lakes Orthopedics. Good morning, sir. Glad to have you with us here today. How are you?
Good morning.
Give us a little background on Dr. Rieber.
Well, we moved to Watertown, my wife and I, with our 3 kids 22 years ago. So we've been in town as Glacier Lakes Orthopedics and then joined Prairie Lakes here a few years back. So it's been my first job. So we've been here a long time. So.
Absolutely. So, that's one thing that we talked with Dr. Johnson last week, too, as well. You guys have a lot of experience, don't you?
Yeah, there's about 65 years of experience combined between the 3 of us. So.
Well, you definitely don't see that everywhere, do you?
No.
So you know what you're doing, that's for sure. What would you say is your favorite part about being in orthopedics?
Well, the thing that drew me into orthopedics is that you can really change people's lives. You can help people and improve their quality of life and get people back doing things. And I grew up, my dad did a lot of carpentry and as a mechanic, so I was inclined to fix things anyhow, and this just fell right into what I could do in medicine.
Absolutely. Well, let's talk about the benefits of total joint replacement surgery. And you're starting to see that with younger and younger people, aren't you?
Well, the ages of joint replacements are trending downward, and that just has to do with people are wanting to be more functional as they get older, and they're not willing to just go sit on the couch. And we want them to be up and active, and so we can help them do that.
Did there used to be a time where, and I think we kind of talked about this before, but there used to be you had to be 60-some years of age before they'd even really consider that?
When I was in my training, that was very common to tell somebody that, you're 49, 50, you have a terrible problem, but we'll fix it when you turn 60. And it just didn't seem to make a lot of sense to me, but over time that has trended downwards. And again, I think that has to do with some of the techniques and our ability to get people active and mobile right away.
When is joint replacement necessary?
Anytime you do a surgery, it's kind of especially like joint replacement, it is the last procedure. There's a lot of things you do conservatively prior to that. So managing arthritis, simply from the standpoint of pain is with medications, anti-inflammatories, injections, lubrication type of things with joints that are available in some cases. Mm-hmm. Sometimes arthroscopy surgery to clean out parts of a joint that, torn cartilages or loose bodies, and then ultimately joint replacement when the joints failed.
Exactly. When I had my knee surgery done, the thing that I thought was a great thing was the joint journey program. That really kind of put me at ease a little more because I knew what I was in for.
Well, that's been a great addition to our program, is to have a class that people can attend and go to before surgery. One of our physical therapists and physical therapy assistants do a great job of just laying it out, all what you're going to experience from the time you schedule your surgery all the way through your recovery and through your physical therapy and the entire hospital experience. They go through that. And it's done in a group setting, which is really nice, so you can talk to other people who've had it and get their experiences as well.
Yeah, I thought it was very beneficial, but it's really about improving people's quality of life. There's no really reason, if you're getting to that level where it is affecting your daily life, to go through that pain, right?
Right. It is a quality of life issue, and it's an elective procedure. It's not something. It's not like you're having a major blockage in your heart that you have to fix it. This is an elective procedure, and it is for quality of life.
Now, when we talk about joint replacement, what do you all do? Which parts of the body?
I do primarily knee, hips, and shoulder replacement surgeries.
What is your favorite one to do? I know you probably like all the joint replacements, but if you had to pick between them, what is your passion?
The knee replacements are fairly routine, and I enjoy those a lot.
Absolutely. If people have any questions and maybe they need to set up an appointment, do you need a doctor referral, or can you just contact you guys?
No, you can call our office directly and get in and get scheduled.
Okay. All right. We wanted to talk about innovations in orthopedic surgery, and we've been talking a little bit off air, and I'm very impressed by this, and it's called Iovera. And if you haven't heard about it before, explain what that is.
Well, one of the challenges with joint replacement, especially knees, is that they can be uncomfortable. They can cause a lot of pain. And over the years, we're trying to reduce the use of narcotics for pain management and the side effects and complications that go with that. So this procedure has been developed to reduce the use of other pain medications and specifically the narcotics. And so it uses cold therapy or cryotherapy. The term for it's called cryoneurolysis. Great big word just to say using cold therapy. So people can relate to friends or neighbors who've gone in and had procedures for back pain where they use heat basically to kill the nerve ending and make it permanently not work, and that takes away back pain in people that aren't surgical candidates. This uses cold therapy, which is reversible. So this is a procedure that we do about 2 weeks prior to a knee replacement, and it's indicated for the knees right now. And it's done about 2 weeks ahead of time, and it just turns off the sensory nerves around the knee. It doesn't affect the muscles. They're targeted nerves that cause joint pain directly around the knee. And so they use a cold probe. It's a needle that goes in right next to the nerve and basically just freezes it temporarily and creates a thermal injury, a cold injury. It turns the nerve off, but it regenerates over about 3 months.
Wow. That's amazing. For somebody that myself has been through knee surgery, a complete total knee replacement probably about 2 years ago, they didn't have that back then. And I think, boy, that'd be a great thing, huh?
No, it's been very effective, and it doesn't make it pain free. And I want people to understand that it's not not going to have any pain afterwards, but it does reduce the amount of pain and a lot of the ability for people to do their therapy right after surgery when it is uncomfortable.
Is that the situation when you talked about, taking the narcotics, for the pain medication? Does that take away where you don't even have to use them, or do you still need to use them for a little bit?
There are some patients who are just using Tylenol and ibuprofen after their knee replacements. Others use some lower dose narcotics. But it is multimodal therapy, so it's not just one treatment or another, but it allows you to use a combination of ibuprofen, Tylenol,
sure,
maybe a hydrocodone or a tramadol or something if you need that. But it overall reduces the pain and allows people to be mobile faster.
And obviously it helps with the pain, as we talked about. But, the one thing that I was telling you off air, with a knee surgery going through it, you get to the physical therapy aspect afterwards. Does that help with that as well?
Right, it does. And it allows people to do their therapy better, which is really a key for the best outcome, is to be able to get that knee moving, get up and be on it, and get the muscles to rehab.
So this has been a pretty new thing that you guys have been using. What have you been hearing from the patients that have had it?
The patients have responded very well to it. Again, everybody's pain tolerance is different. But we've been offering this since April, and it's been a well-received addition to the toolbox that we have for pain management.
Sure. Is this only being used on knees right now?
Right now, it's only on knees. There's some other indications to use it, but primarily we're using it for knee replacements.
Okay, sounds good. So if you're in store for maybe a total knee replacement, and when they see you guys, that's something you bring up, and it's a different way to do it. And I think probably puts a lot of people at ease knowing that as well.
Well, Again, it's about setting expectations, and so you want to make sure people are aware that they're not going to have their surgery and have no pain for 3 months. It is the effect lasts about 3 months after surgery, and it does help.
All right. Sounds good. Well, if people want to learn more and get an appointment with you guys, they don't need a referral, correct?
No, they can schedule directly with our office at Prairie Lakes. The number to our office is 605-882-2630, and they can schedule an appointment.
All right. Very good. That's Prairie Lakes Orthopedics, Prairie Lakes Healthcare System.